My question is to the Associate Minister of Health and asks, what actions has the government taken to increase New Zealanders' access to medicine?
Mr. Speaker.
The Honourable David Seymour.
Thank you, Mr. Speaker. Many, most notably, filling in a significant fiscal cliff in Pharmac funding last year and then boosting Pharmac funding by around $600 million. However, we're also taking actions on consenting of new medicines by introducing a policy known as the Rule of Two. This is a policy that all three coalition parties campaigned on in the wake of COVID, and in essence it means that if two other recognised countries have certified a particular medication, the expectation is it will become legal in New Zealand within 30 days.
Supplementary. Why is the government progressing the Rule of Two pathway to speed up the approval of medicines already recognised overseas?
Mr. Speaker, there's always been an absurdity in New Zealanders waiting long periods of time. In the case of one recent asthma medication, 16 months for MedSafe to tell the New Zealand people it is safe for them to use a medication that is already widely used and legal in countries such as Australia, the UK, United States, Switzerland, Japan, Canada and Singapore, all countries that have a very strong track record around their health systems and their management of pharmaceuticals. I'm not aware of any time in New Zealand history where New Zealand has had MedSafe reject a medication able to be used in one of those countries and they realised they'd made a mistake. We are simply duplicating work by insisting that we overdo our consenting of new medicines when they've already been consented in multiple other countries.
Supplementary. How will the bill improve New Zealanders' health outcomes?
Well, Mr. Speaker, it's absolutely critical that medications that are consented in other countries are available to New Zealanders. We aspire to have first world living standards and first world healthcare. If I look at a medicine such as Ozempic, which has huge potential, it remains unconsented for some uses, and I believe it could be of great benefit to a lot of people. The question is, why should New Zealanders wait, perhaps indefinitely, because the manufacturers of pharmaceuticals see New Zealand's consenting regime and its small market size, and they wonder why on earth we are duplicating processes that they've been through elsewhere.
Supplementary. Are there other countries that have a verification pathway like the one proposed?
Well, yes, indeed, Mr. Speaker. I prefer New Zealand to be leading the world wherever possible, but in this case, we're very much trailing. Countries such as the United Kingdom, countries such as Singapore, also routinely take advantage of other countries consenting of new medications with policies that you might compare to our Rule of Two. We're not blazing a trail, but we're certainly ensuring that New Zealand policy keeps up with best practice worldwide. The United Kingdom, for instance, is one of the fastest consenters of new medicines in the world.